pandemic has not affected all communities equally. Here's a look at the racial disparity of COVID-19's impact.
The disturbing reality of this pandemic.
This virus is disproportionately hitting Black Americans.
Across the country, African Americans are contracting the coronavirus and dying at disproportionately higher rates than other racial groups. In Michigan, African Americans account for 40% of coronavirus deaths, despite comprising only 14% of the population. Several factors contribute to the African American community becoming more vulnerable to coronavirus, and it has a lot to do with deep-rooted structural inequalities. First, African and Hispanic Americans disproportionately make up a majority of low-wage essential jobs. This includes grocery and factory workers. Most of these essential jobs cannot be done from home, putting this group at a higher risk of contracting coronavirus on their way to and at their workplace. African Americans are also more likely to be uninsured or live in communities with low-quality health care. Research shows African Americans receive worse medical care even when income, education, and socioeconomic status are taken into account. Missing this vital care has led to an increase in pre-existing conditions such as diabetes, hypertension, and heart disease among African Americans, conditions that increase their chance of complications after contracting the coronavirus. We are still trying to understand the full extent of the disparity, as some states have yet to release coronavirus statistics by race. But one thing is for sure, the pandemic is exposing gaps in health coverage and inequalities that won't go away, even when things get back to normal.
And COVID-19's impact on the Black community is why Tulane's Dean of Public Health is launching a new initiative. It's called The Skin You're In, Coronavirus and Black America. He's joining us now to expound on his mission, and not to mention that, he's also the co-chair of Governor Edwards' COVID-19 Health Equity Task Force. Dr. Thomas LaVeist, thank you so much for joining us this morning.
Thank you for having me.
Yeah, tell us more about this initiative.
The initiative is designed to combat some of the false information that's been targeted to the Black community. So, for example, early on in the pandemic, there was a widely circulated myth that African Americans were actually immune from the virus, which has no basis in science, of course. And if these types of myths are circulating within communities, it may affect the way that we behave. People may be less vigilant, less careful, and less willing to listen to authoritative information.
Yeah, and so what are you guys doing to try to change what we're seeing here?
Right, so what we're trying to do is to put out authoritative information so that we can counter the misinformation that's been targeted to the Black community. We're doing that through social media, through other means. We're getting on television, radio, even going out into the communities and talking to people, putting up posters.
Yeah, and you are also the co-chair of the Governor's Health Equity Task Force. Tell us what that task force is doing.
Yeah. So when the governor discovered, when the data came out and discovered that African Americans were dying at disproportionately, the governor established a task force with the goal of also providing accurate information to the community, helping to advise the governor about how what's an effective testing strategy, how we get those tests into the communities that need it most, and also how we come out of this pandemic and not go back to what was our old normal, which was a normal of inequitable health care and equitable health outcomes, but come back to a new normal, one that is not inequitable.
Yeah, you make a great point there. There were health inequities before this disease impacted our communities, this virus, and a lot of people are acting like it just was invented when the virus popped up. This is just revealing what was already there.
It's revealing what we've known for as long as we've had data. We've known that there have been these disparities in race and health. But the pandemic has been helpful in that it's shined a light on it. It's now out in the open, and now I don't think anyone can say that they're not aware of these racial disparities.
Sure, I've talked to lots of experts and just people in the public about this issue. A common response that I get is, well, Black people need to eat better. It is a simplification of really complex problems that have led to where we are now and why Black people have more health issues.
Absolutely. Well, I mean, I'd say, look, Black people do need to eat better, do need to exercise, do need to smoke and drink less. White people need to eat better and exercise and smoke and drink less. Hispanics need to eat better. And every American and every ethnic group should eat better. We have extremely high rates of all of those chronic conditions among whites here in Louisiana also.
Yeah. What do you think that the public can be doing at this point?
Well, the public can be taking seriously this pandemic. You know, I still see people walking around the streets of New Orleans not wearing masks. people that are not exercising precautions in terms of getting close to people. So we can take this seriously. The virus may be invisible to the naked eye, but the number of deaths that has occurred is not invisible. And we need to understand that this is a very serious pandemic that we're going through.
Sure, and you hinted earlier that we need to look at what this looks like when the pandemic is over to address some of these issues that will still exist.
Exactly. Well, annually, we're in a race for who is the least healthy state. We're battling Texas and Mississippi every year for who's at the bottom of that list. I'd like to see us come out of this pandemic and not go back into that competition.
Sure, and how do we change some of the things that are leading Black people to be dying more from this? Access to food in certain neighborhoods, that Black people are more likely to work in jobs where they aren't able to stay at home or have good health insurance.
Right. And those solutions are not medical solutions, right? They're social and economic solutions. We need people to be able to develop their human capacity so that they're able to be competitive to get the types of jobs that will allow them to move into other neighborhoods. But also we need to look at how we're distributing resources within the city. So supermarkets not located in certain communities, those are solutions that are not on individuals, but rather there's policy that we can enact to make a difference.
Sure, it's a lot of things that need to change to see these numbers change. Dr. LaVeist, thank you so much for joining us this morning.
Thank you for having me.
Dave?